Does having a learning disability or ADHD mean or inherently mean that you have a lower IQ?
That is a question that I have to answer for most people when I do an evaluation because they certainly don't feel as smart, right? A kid with dyslexia going through school looks at all the other kids and they're reading faster and they're at higher reading groups. And the only answer, because kids are very egocentric, the only way that they can understand that is that I'm not as smart as these kids, right? Even though reading is just this cultural phenomenon that we've hasn't even been around that long compared to language and other skills, right?
Yeah.
So, and then with ADHD, they don't feel as smart because they always have to ask questions, or they don't remember the instructions, or they're slower to do things, or they make silly mistakes. So of course they think they're not as smart. So the short answer is it has nothing to do with IQ. And that's something I have to explain to kids. And once they realize, you mean the fact that I can't read has nothing to do with how smart I am, it completely changes their worldview. And we do all sorts of different games and visuals so they understand, like, look, dude, you are incredibly bright.
Right.
Even though your reading is way down here, like, you have all these incredible skills.
Anyway, okay. So let's get started.
All right.
Tell the audience a little bit about yourself and what you do.
All right. So my name is Dr. Oren Boxer. I'm a pediatric neuropsychologist, which is a mouthful, but my job is really to help parents understand how children process information. A lot of parents come to me because their child's having difficulty in school, they're having difficulty in social situations. And so my job is to really understand from a neurodevelopmental perspective why we're seeing these difficulties and how to help them. Okay.
So how did you get into this field? Like this is, you didn't just like go to school for 2 years. You like, how long were you in school to learn how to do this?
Long time, more than I want to admit, but
No, please do. There's people that might be interested in going into this field.
Yeah. So,
hold the mic up to almost as close as you can.
How's that?
There you go. You notice the difference?
Yeah.
So
All
go
right.
ahead.
So I've always been interested in the brain. It's just, neuroscience, the brain, it's something that's always interested me. And I've always been interested in working with kids. Even in high school, I think was the first time I volunteered with the special needs class in my high school. And I would help them with just basic homework and things like that. And I felt I would make a connection with these kids. And so as I went through high school into college, I kind of focused a little bit more on neuroscience, and I loved development. And then I found that neuropsychology was a great marriage of the brain, development, and, psychology.
So what is the, you can describe it as much as possible, but what is the big difference between a neuropsychologist and a psychologist?
Yeah.
What really distinguishes you from a general psychologist?
Right. So there's actually guidelines that have been put out. The Houston guidelines are actually going to be updated in, I think, next year. They were put out in the 90s, which say that in order to be called a neuropsychologist, not only do you have to go to graduate school, which is 6+ years after college, but you have to have 1 year of internship training in neuropsychology, and then 2 years of postdoctoral training in neuropsychology.
I'm doing the math. You've got 4 years plus 6.
Yep.
Plus 2 plus 1.
Yep.
It's a lot of years.
A lot of years, a lot of student loans. Yep. But I get to hang out with kids and play, all day. That's what our assessments are like.
Yeah, you also chose pediatric. I'm a child and adolescent psychiatrist. So, in terms of what you find most meaningful out of working with that younger population, what would you say is the most meaningful part of that?
I'd say the most meaningful part is really connecting with the kids. I mean, the testing is fun, and the kids have a great time. They all want to come back. It's actually a little weird. And it's, at times like they want to be, I have them on my PlayStation and Switch friend list, and they friend me and they want to play, outside of testing, or they want to come back and hang out because during breaks, we really have a good time and there's so much focus on them.
Right.
So connecting with the kids is really the best part. And my favorite part of the assessment is after I've talked to the parents about what's going on, I get to sit down with the kid and I get to talk to them about how their brain works and answer all their questions about why they're struggling and really help them understand that, hey, it's not that you can't or you're less than. It's this other thing. Right? Here's what it's called, and here's how we can help.
Right.
And I just watching their eyes light up and realize there's nothing really wrong with me. I'm not dumb. I have all these skills, and there's something I can do that could really help me.
Right. So what age range do you work with?
I typically see kids school age. So the youngest would be 4 or 5, but I would say the sweet spot for an assessment is about 8 to early adolescence.
Okay. So why do you use the term sweet spot? What do you mean by that?
Because from a developmental perspective, 8, 9, 10, 11-year-olds, they're going through literally at that age a massive developmental change. Most parents will say, oh, my kid has gotten so much more mature around 10, 11, 12,
yes.
right? More insight. And so I feel like the kids that we evaluate around that time can benefit the most from some of the treatment recommendations we have afterwards.
What goes into, because I've never done an assessment. I've never taken part in one. I think I've looked at the results of one.
Yeah.
But I've never actually seen one conducted. So what are some of the components that go into like an evaluation, and not necessarily for ADHD, but even a neuropsych testing in general?
Yeah. So when you work with kids, and you know this, kids have to feel comfortable right when they come in the office.
Mm-hmm.
So we have a really fun office in South Pasadena. Kids come in, our waiting room. Right now, we're all decked out in Halloween stuff. So last year, I had a kid that was terrified of jack-o'-lanterns. So before he came in, I had to quickly take all those down.
Yeah.
But they come in and we have, Lego TIE fighters on the wall. We have, Mario Kart pictures up on the wall. It's really a fun environment. They feel completely at home. And so the assessment part really starts there. Once they come back, I actually don't do any testing for a good 45 minutes to an hour.
Really?
Yeah.
Really?
I just spend that time playing with them. We play Uno. We play other games. Believe it or not, a game of Uno will tell me a lot about a child.
I agree. I agree completely.
Yeah. Yeah. Better
yeah.
than some tests. I mean, everything from fine motor skills. How well can they hold the cards? Are they dropping cards all the time? Do they remember whose turn it is? Are they willing to sacrifice the social relationship to win? Right? How do they handle losing? So much can be learned from Uno. I mean, numbers, colors, everything for the younger kids. So there's a lot of play that happens throughout the whole assessment. But then once they're comfortable, we look at intellectual development. That's a main area where we understand how they process information. And then we go into look at academic achievement. So broadly, if there's no concern, we'll still check for reading, math, and writing. If we see concerns along the way, we'll dig a little bit deeper and say, why are we seeing this reading concern? Right? That's where the neuropsych stuff starts to happen. Is it something about how they decode? Is it something about how they process auditory information?
Are these questions like Likert scale questions, or are they just, you're asking them broad questions like verbally, or are they writing stuff down on paper?
Yeah.
Like,
So the IQ test is a lot of questions like, how are these things alike? Or can you define this word? Right. But they're also, can you put these blocks together to match this picture? So a lot of visual motor,
right.
A lot of problem solving. Everything's interactive. The kid's never sitting there just filling out a form.
Okay.
Yeah.
Well, that would be why you have PS4 and all that other stuff.
Right. Yeah.
Okay. So the very first stage that you're doing, you're getting the child comfortable with actually being there, because that just sort of sets the stage for them so they can actually participate without nervousness and everything.
Right.
Okay,
Yeah.
interfering.
We can't have that affecting their performance.
And then it's more of an interactive sort of test.
Absolutely.
Okay. How long would you say it takes total for the testing process to happen for neuropsych testing?
Probably a good 10 hours of testing.
What?
Yeah,
Okay,
I know.
Okay.
Every psychiatrist has that response, by the way.
Wait. Okay, yeah. Let's back up.
Yeah.
When you initially described it, I got the 45 minutes of playing and getting them comfortable. Okay.
Yeah.
And then I thought it would be like an hour of.
No.
Okay.
We really get to know these kids. It's usually
Okay.
2 full days of testing, 9 to 3.
Wow.
Mm-hmm.
Okay. So walk me through that then.
Yeah.
Because I cannot imagine. I've done tests for 10 hours before. There's, MCAT step 1. Those
Right.
are tests in med school. I can't imagine. No. Walk me through it, please.
Yeah,
Okay.
there's nothing like that. Thank goodness. I couldn't do that.
Yeah.
But it is. So like I said, they come in, around 9 o'clock, we play for a while. But the pediatric tests are very game based. The kid doesn't really feel tested. They're putting together a puzzle. They're thinking with me about different ideas, but it's standardized, right? This is the gold standard for measuring IQ, for example, the gold standard for measuring academic achievement. But like I said, it's very interactive. Like the academic stuff is dry. They have to read a passage quickly, or they have to read a list of words. They have to do math. Like I can't make that more fun. It is what it is.
Right. Yeah.
But then on the second day, there's a lot more focus on attention. So we just got a new virtual reality attention task where it actually puts the kid in a virtual classroom, and then we're testing their ability to stay focused with different distractions that are happening.
What, it's like VR?
Yeah, I got the Oculus on them, and they think it's super cool.
You're kidding.
Yeah.
I won't play that game.
It's well, it's
It's not a game, but okay, fine.
Yeah.
I still want to try it. Yeah.
It's really cool. So they enjoy that. But so we look at attention, also how they learn and remember information, so their learning profile, executive functioning skills, what their study skills are like, how do they plan and organize, inhibit, cognitive flexibility. Plus, the fact that I had them over 2 days, we've built rapport.
Mm-hmm.
So by the end of the second day, I'm asking questions about social emotional. What does it feel like to, struggle making friends? Or what does it feel like when how do you handle stress? Like, what do you do to de-stress that stuff? They're open at that point. And I'm really able to see, get an idea of their inner social emotional world.
What is the most difficult part about the neuropsych testing for you and for the patient? What's the most difficult part?
I think for the child, it's having to do hard things, right? Things that they've wanted to avoid. Kids that come in with a question of dyslexia, I'm going to make them read a lot and do things that they don't want to do. And if I don't have their buy-in, or I don't have the rapport there, they're not going to put in the full effort. So I think from the child's perspective, we have to do that thing that parents or teachers say it's hard for them, right? I think from my perspective, the most laborious thing is getting these reports out, because they're really comprehensive. We take into account all of the different parts of a child's development and put it in the report.
The results.
Yeah, the results. So that takes a long time, probably the least fun. But I would say the actual working with the kid is great from beginning to end.
No one likes paperwork.
No, exactly. Right.
No one likes paperwork. So as they get older, though, how does the test change?
Right. So, well, most teenagers can sit and work for longer periods of time.
Yeah.
So usually with an adolescent, I would need a day and a half, and I can get everything done because they sit and they do the work. And the tests, once you're 16, you get a different battery of tests because it's just normed differently. And they're a little bit more, they're more challenging because they're all, age appropriate.
Mm-hmm.
But, oftentimes by the time I see an adolescent, there are bigger picture concerns like, dating or other relationship issues, or sometimes there's entrenched, anxiety that's been there for a long time, and we're seeing some OCD symptoms. So it's just a little bit different when they're older.
So by the time they get, whatever age that they're at, the testing, because I focus on ADHD just then.
Yeah.
You elicit basically all of the DSM, or most of the DSM at least.
Yeah.
Okay, you get a pretty accurate picture of what they're like. Okay.
Yeah. Because a lot of parents come in and they don't know what's going on, right? And even after the parent intake, I'll have a sense of what it is, but I'm not even sure either until we get through it. And, the assessment battery is very flexible. As I see a certain pattern, I'll keep giving tests to see if that pattern actually leads to diagnosis or not. If it doesn't, I'll be looking elsewhere. So we really capture everything to see because it's not based on a diagnosis, right? It's based on how do we help this kid and what's going on.
Right.
And then if that information leads to a diagnosis, we talk about that.
Okay. That's important information. For me, that's a very important point for me to always try to remember, is that it's not always the diagnosis. Unfortunately, what happens is you need like a diagnosis to code. Yeah. The coding gets insurance companies. That way the patient can actually get the care funded.
Yeah.
So that's kind of how my mind is. But for you would say it's mostly about trying to figure out what bits and pieces go into like who this person is, so they can get better.
Exactly. I tell parents, I feel like my job is to help them understand how their child sees the world, right? And if developing that lens to show parents, say, look, this is how they process information. If that leads to a diagnosis, we say, okay, this is consistent with ADHD, or this is consistent with a nonverbal learning disorder, whatever it is, that's separate from helping parents understand how to help them.
I don't think most people know how long the process is and how much work goes into those reports. I've seen the reports, but I did not know that it would be 2 days long.
That's right. And a lot of parents, when I say there's 2 days of testing, they're like, my kid can't do 2 days of testing.
Right.
I'm like, dude, they can go to school all day. They're going to like time with me better than school, right? Because we don't test for the entire time. We test for maybe 10 or 15 minutes at a time, and then we take a break and do something fun.
Right. Yeah. So I asked about ADHD, another diagnosis, even though we've agreed that diagnosis is not as important, but you know what I'm saying. For the diagnosis of autism, have you also noticed an uptick of people that are concerned that they have autism amongst the younger population?
Yes. Yeah.
More so than ADHD, or about the same?
I would say a little bit more.
More. Okay.
And I think that has to do with more access to social media, like TikTok, for example. There are a lot of adolescents on there talking about their experiences and how they think they have autism. And then there are other young adolescents who see that and think, oh, I have similar experiences when it comes to how I can't stand when it's too noisy, or I don't like the feeling of like certain clothes, or I always had trouble fitting in, right? And they say, well, I might have autism as well. And they tell their parents, I want to get evaluated.
Would you say that is a good thing, a bad thing, or something else?
Yeah, I know. I've been thinking a lot about that. I think it's good that kids see other kids struggling like they struggle. I think that part's good, to know that they're not the only one. I think it's a good thing that they're willing to get more information and figure out what's going on. I think it's a bad thing because they come in with a predetermined, diagnosis or what they think they have, and oftentimes it's not that. And so it takes them a little bit longer to get to this point of understanding, okay, I really thought it was this. I brought this into my identity, and now I have to think differently. And that process takes a little bit longer.
Yeah, I've noticed that. It becomes a part of the identity. And when you find out, oh, I didn't get this diagnosis, now who am I? Now, why am I struggling like this?
Yep.
Why do I feel so uncomfortable? If it's not autism, what is it?
Exactly.
And I noticed that clinically. I don't know if it's a good thing or a bad thing. I don't know yet. We might know in about 5 years or so.
Yeah.
It's just right now there's more information out there, and I do think it's good that people are more interested in addressing mental health issues, but you definitely don't want it to be due to misinformation.
Right.
Yeah.
Yeah. A lot of the people, on social media, they get a diagnosis based on an online questionnaire or something, nowhere near as, a vetted evaluation, a comprehensive evaluation.
So switching gears to IQ testing. With IQ testing, what do they actually tell me about someone's intelligence level?
Right. So, that's a really good question. I mean, historically, IQ tests have not been very culturally sensitive. And so there's been a lot of cultural bias that have been part of IQ tests in the past. Yep. That's actually a lot better than it used to be. So the newer IQ tests, have a lot more cultural sensitivity and awareness in them. So having said that, IQ is really, it's an interesting idea, but there's a lot of ways that research kind of suggests IQ is. There's verbal IQ, there's visual spatial IQ, there's all these other components of IQ.
Different ways of measuring intelligence.
Yeah.
Yes.
Yeah. But if like the 30,000 foot kind of understanding is that IQ is someone's ability to abstract, to think that not just A plus B equals C, but to be able to say something like A and something like B could be something like C. So the more you are able to abstract a situation, the higher your intelligence is. So you're able to generalize learning to different situations that might be similar and predict an outcome. That's probably the best understanding of IQ.
How long does the testing take for IQ?
The IQ testing is probably the first thing we do. I would say about an hour and a half.
So that's a part of a basic neuropsych testing evaluation. Oh, okay. So that becomes a part of it.
Huge part.
Oh, okay.
Because that really is the whole framework of where to expect academics. For example, a gifted child, we wouldn't expect grade level academic performance. We'd expect above grade level performance. If we're not seeing that, we've got a problem, and they feel it.
Got it.
So it tells us everything.
Oh, so with IQ, that kind of sets expectations in certain areas, and then when there's, you could call it a deficit. When someone isn't achieving as much as the IQ says that they might, then that tells you, hey, I need to look at this. I need to understand this a little bit better.
That's right.
Okay, understood. Well, how accessible is neuropsych testing?
Yeah, so that's a good question. It's right now, myself and my colleagues are booked several months out, so that's difficult. Plus, the price is really high.
Yeah.
I've designed my practice to have graduate students and trainees that work with me so they can have their fee at a lower rate so families can access that. Plus, if a child's part of a public school, I talk to the family about ways that the school can pay for an evaluation. So
Interesting.
there's an IEE, which is an independent educational evaluation. That's a contract that the school would have with our office, for example, to pay us to do a neuropsych, and doesn't cost the family anything.
Might want to say that one more time.
Yeah, right. So,
all right, so I'm going to ask you a general question. If someone were looking to pay for neuropsych testing, what are the different ways that they might be able to go about that?
Right. So a family can certainly pay privately, and I have different fee structures. So that my fee is one of the higher ones, but I have other colleagues that their fees are lower. We don't take insurance, but there are clinics that do take insurance, and so sometimes we refer families there.
Okay.
And they can get something reimbursed. And then if their child is part of a public school, there's something called an independent educational evaluation that's part of an IEP, that's part of a student support program.
Okay.
And a parent can ask the school to do an evaluation with someone like myself.
Outside of their school psychologist.
Correct.
Yep. The school will still pay for it, just with an outside person.
Yes.
Okay. Because not everyone knows what an IEP is. That's a whole nother story.
Yeah. Yeah.
Getting an IEP is difficult because sometimes you might need neuropsych testing or psychological testing before you get the IEP, or is that backwards?
No, you're right. And unfortunately, in most cases, some kids have to be behind by 2 or more years before a school will even consider doing an assessment for an IEP.
So they have to be doing poorly enough, and if they're not doing poorly enough, it's hard for them to get the testing.
Yeah, exactly.
Right? Yeah.
And it's not really the best design.
It's not. But again, I think it's important for people to understand how, if you're interested in getting this stuff taken care of, that's a route that you can go. Now, if they don't have an IEP through the school, are there other ways that the school might pay for it, or are there other ways or other alternatives, or are those the main three?
I mean, some schools are better than others. Like our local school district is great. They really work with families and they offer services outside of an IEP. Because really, to be honest, all the research shows this. The more support you give a student from a younger ages, at the lower grades, the less likely they're going to have bigger problems as they get older. And those bigger problems are more costly. Right. So some school districts have figured it out that you address the issues while they're young. Other schools haven't figured that out. And so sometimes families have to get an attorney or an advocate to help them through the process.
An attorney?
Mm-hmm. In the worst case scenarios.
When the school is really, really resistant to paying for the testing.
Or providing services that they feel that their child needs.
Got it. Is that something that you encounter or have encountered in the past?
A lot.
Really?
Mm-hmm. Because we offer part of our structure to be available to different SES, different socioeconomic statuses. Mm-hmm. We take IEEs, so these assessments don't cost anything to families, and so most of the time, by the time they get to see me for an IEE, they have an advocate or an attorney that has helped them get to that point.
Oh, got it. Oh, okay, I understand. You mentioned that. I mean, you're very passionate about this. You mentioned there's a lot of stuff that, I mean, I've asked you a bunch of questions thus far. Is there anything that you would like the public to know about what you do or the help that your clinic provides?
No, I mean, yeah, I just, I love talking about this stuff. I feel like there's just not enough people who understand what it is, or they feel like it's overkill. Let's just go get on a medication, or let's just do, a therapist. But, before parents spend money on something that might not be helpful, or a child, even worse, has to devote time to something that's not going to be fruitful, I always say, let's figure out what the problem is first and then put treatment in place. I guess the only other thing is that, a lot of parents think that a neuropsych assessment is scary and they don't want to do it. And I get that concern a lot from families. And I just want them to know that if the child is suffering, there's nothing that I'm going to find that the child isn't already experiencing on a daily basis, right? It's my job to bring it out and name it, so it's not so scary, and say it's this. Isn't that this silly? It's just this. It's not you, right? And that is not only therapeutic, but I mean, it could really change a child's worldview, how they think and how they feel about themselves.
Okay. So where can we find you if they were interested in seeking your services? Where's your practice?
Yeah. So I have an office in South Pasadena, and we have different services that we offer. We just opened a new after-school program, which is super cool, but we have therapy, we have mindfulness, other therapies that we offer there, as well as testing. And I have an office in the Palisades as well.
Well, question about therapy. I have a ton of patients that are interested in not so much medications, but behavioral techniques for, say, autism, say ADHD, even dyslexia. You guys offer that sort of stuff as well, behavioral techniques?
Yes, absolutely. And the research suggests that it's really not just medications, both that and the behavioral intervention that really drives the success.
Is there a definitive amount of treatment time, or is this something that will be ongoing throughout their life, depending upon the diagnosis? I think autism you might need more continuous, and ADHD, I don't know how long that might take to get skills. And
with ADHD, it's more focused. I mean, if there's also anxiety or some other mood that goes with it, right?
Of course.
Then the therapy addresses the anxiety, but it should be finite in the sense that there should be 8, 10, 12 sessions and then a check-in. It shouldn't just go on forever, because the goal of a therapist is to treat, and they get better and they move on. So that's how we offer services.
Okay. And how much of a connection do you think psychologists and therapists have with psychiatrists, medication management people? Like how often, like I'm a psychiatrist. How often do you talk to psychiatrists?
Pretty regularly, actually.
Okay. That's awesome.
Yeah.
Good.
I do because I'm talking about ADHD. And, a lot of psychiatrists reach out to me, and because, as you know, treating ADHD in a child who has attention deficits and anxiety is a little bit different than just treating a straight ADHD, as well as ADHD and autism. Those kids don't respond to stimulants the way a kid with just ADHD does.
Right.
So, yeah, I get a lot of calls.
Awesome. I'm trying to increase the amount of connection that therapists and psychologists have with psychiatrists. You go out in the community, it's just, there's not that much conversation going on.
Oh, yeah. Well, I made it a part to have a lot of those people as part of my practice. So it's like a group approach most times to evaluate kids and support them.
Oh, so you kind of step outside of what the norm is to make those connections.
It should be the gold standard, right?
Yes.
Yeah.
I would agree with that. Yeah. So I'm just trying to, that's why I'm glad I had you come in and speak with me. So, okay. So again, you have an office in South, you want to give the address and phone number, or
sure. Yeah.
How do they contact you?
It's in South Pass, so it's 625 Fur Oaks in South Pasadena, right across from the brand new Krispy Kreme, which is dangerous. So it's right there. And then, they can contact us at the number 626-765-4482, and the website, if they just search insightcollective.com, they'll find it.
Do you offer in-person services or all tele, or both?
I'd say it's mostly in person.
Mostly in person. Yeah. Can't play those video games online.
Yeah. It's different.
Okay. Anything else before we end?
I think that's it.
I appreciate you stopping by.
Yeah.
Had a fantastic time. I think I learned a lot. We're all finished.
Cool.
Thanks.
Great.
All done.